Dear ladies and gentlemen, dear colleagues and friends, a very warm welcome and thank you for taking the time today in joining us in the webinar Global Health Architecture Post-COVID, Curse or Blessing for Reducing Fragmentation and Strengthening the WHO in Pandemic Preparedness and Response. My name is Maike Voss. I'm Managing Director of the German Alliance on Climate Change and Health, where I also work on political determinants of the COVID-19 response and on global health governance. The ongoing war in Eastern Europe, of course, will affect many, if not all of us. We live in a world with high uncertainty and the pandemic is far from over. That's why today's discussion is very much needed, of course. This event is part of the discussion series of Global Health Hub Germany and the Federal Ministry of Health, Shaping Health Globally, from the German Global Health Strategy to Shared Commitment. I hear here and there some background noise. Maybe you can mute yourself. That would be great. Thank you. Right now, one very important priority area of the German Global Health Strategy is the further development of the global health architecture with a central role for the WHO, the World Health Organization. The Global Health Hub Germany is a network representing over 1,500 diverse members from 8 different stakeholder groups, making it a great platform to discuss this priority today in the light of the current international debates. Maybe you want to check out the website of the Germany's Global Health Hub for more information and for more future events. Before we start, of course, some words on housekeeping. One I just said with the ask of you to please mute yourself. You also noticed at the registration that this event will be recorded, and we also already started the recording. And you can participate later in the discussion by posting your questions and comments in the chat, and we will have time to come back to your questions later in the discussion. We counted a little bit, and we have more than 300 people who have registered for this event. I see we are now over 100 people here in this room. Most participants come from Germany, the United States, Switzerland, Canada, and Belgium. And we are also very delighted to have participants from several countries in Asia and Africa as well. Most of the participants are representatives and colleagues from international organizations, academia, and civil society. As the title indicates, we will be talking about global health governance, fragmentation, and the role of the WHO in pandemic preparedness and response. The corona pandemic has revealed major gaps in the already very fragmented global landscape in global health. There is international consensus so far that global pandemic preparedness and response has to be strengthened and better financed. But there are, of course, many open questions. How to assess the many options on the table to improve pandemic preparedness and response is one and maybe the most urgent. What is the potential for reducing fragmentation of the global health institutional landscape? How can WHO in its central role be strengthened? And how can WHO member states put their words into action? I'm very happy to be discussing this with a very great panel of speakers today that bring different perspectives to the discussion. And I'm very happy to introduce them to you now before we start into the discussion. With me is Kate Dodson. She is Vice President and for Global Health Strategy at the United Nations Foundation. Next to many other activities, in 2020, she co-led the COVID-19 Solidarity Response Fund, the large non-traditional donor finance instrument to support WHO's global COVID-19 response. Kate, I'm very happy to have you today. With us is also Amanda Glassman. She is the Executive Vice President and Senior Fellow at the Center for Global Development and CEO of CGD in Europe. Amanda's research focus on priority setting, resource allocation, and value for money in global health, as well as data for development. And I think when you are in the field, you have, or you must have read papers that are authored by Amanda. Amanda, good to have you. And we also have Björn Kümmel, who is Deputy Head of the Unit on Global Health Policy at the German Federal Ministry of Health. He has also served as a vice chair of the executive board and chairman of the program, budget and administration committee at the EB. And I think all people in global health in Germany know Björn Kümmel, so I don't even have to introduce him to you. Very unfortunate, Idrissou Yabuku, the Minister Counselor at the Ghana Permanent Mission to the United Nations Office in Geneva, had to cancel his participation today due to other obligations very last minute. But we, of course, look forward to introduce him and welcome him next time when we have discussions on this or other matters. In the next 30 minutes, approximately, I would like to discuss and open the floor for questions that we have prepared for the panelists, but also to your questions afterwards. So please feel free to post your questions into the chat box. We will come back to that. But Mr. Kümmel, I would like to ask you now to maybe set the scene a little bit for us and for this event. And I give you the first questions, that is, what proposals regarding financing and management of pandemic preparedness and response are currently being discussed at the international level, for example, in the G formats or also at the WHO Executive Board? Which considerations may play a role in this? Maybe you can give us an overview.
Okay, thanks a lot, Maike, and it's a pleasure to be with you. Indeed, there is quite a lot ongoing in global health when it comes to financing for preparedness and response, but also financing overall. In my current position, I have the pleasure and honor to be the chair of a working group that was established by the WHO with the view to ensure sustainable financing for the WHO. So practically the same topic. And what I've been saying to the members of my working group is that while we are discussing finances for global health or finances for pandemic preparedness and response, in the end, we are not doing something technical here. What we are doing is we are reshaping global health post-COVID. And this is one of the most exciting times, I think, that I can oversee, let's say, the last 10 years of global health. I think that global health architecture will look completely different compared to the era before COVID and the era after COVID. And why is that the case? That is certainly linked to new ways of financing and shifts in financing that we will see. So practically, financing is all over. We will see this year the replenishment of the Global Fund. We will see replenishments of Gavi. We will see replenishments of CEPI, all linked also to pandemic preparedness. We are having discussions in the G20 to establish a new financing facility. This is an idea that came up through the Independent Panel for Pandemic Preparedness and Response, and which is pushed, I think, by the US and Norway in particular. So to create a new financing facility primarily for pandemic preparedness and response with an overall budget volume up to 10 billion. That was at least the initial idea. I think, if I'm not completely mistaken, the Global Fund replenishment foresees roughly 18 billion for a specific period, etc. In the G7, Germany currently hosts the G7. We are focusing on the strengthening of WHO, which is closely linked to the ongoing work in my working group at the WHO, in the board. There's also another process or two other processes that I think we need to be aware of. There's a working group that is supposed to strengthen WHO's role in pandemic preparedness and response. And linked to that is the strengthening of the international health regulations, also a key tool for pandemic preparedness and response. Plus, we have just in the WHO started an international negotiating body, a lengthy process with a view to establish a new pandemic treaty to cover more or less all aspects of pandemic preparedness and response. Last and final thing from my side, one of the key debates where Germany is very active in is ensuring sustainable financing of the WHO. And I think it becomes clear throughout this entire crisis, COVID crisis, that the expectations that the world has and member states have on WHO by far outweigh WHO's given abilities. WHO is heavily dependent on individual donors, be it state donors or non-state donors, and only 16% of WHO's financing today comes from the member states itself. And that is being discussed in my working group. And there is a concrete proposal to increase the core funding for WHO through the membership fee up to 50%, but it's highly controversial. And it's there are many member states in favor, I would say over 100, maybe 150, but there are some still very, very reluctant. And while we will see that the Global Fund, Gavi, CEPI, and the new FIF will receive funding in the next year or 2 years, and I hope they will because they are essential, it could easily be that the World Health Organization, which is the lead and coordinating agency in global health, will remain chronically underfunded, which would be a disaster. So I think the main question is, will global health governance post-COVID be less fragmented, more efficient, better coordinated with less duplication and truly inclusive? And that, from my point of view, would mean that we truly strengthen the WHO in this overall setting, or will the picture post-COVID look differently? And sorry for taking so long, setting the scene.
Thank you very much, Björn. And also thank you for giving an overview of all the different initiatives that are being discussed. Maybe, Amanda, you can help me unpack this a little bit and tell me a little bit about the context, or us a little bit about the context by answering the questions. There are so many recommendations and lessons learned and reports. Why is pandemic prevention and preparedness not working nationally and internationally? What are the reasons? And could you give us some more context on the need for better finances in pandemic preparedness and response?
Yeah, thank you so much for the invitation, Maike, and for that good scene center, Björn. So I think, just to step back for a moment and say something about the state of preparedness. And by preparedness, we mean a country's ability to do surveillance, detect and rapidly respond to an emerging pathogen. And it should also be said that, most of these kinds of emerging pathogens will happen in low and middle income countries. The exception are things like SARS and coronaviruses and influenza. And so, when we talk about preparedness, it's necessarily a global view. It's not just that development, low-income countries as the top priority. Low-income countries should be a priority. I think we've seen the opposite of that during COVID-19, but I think we also have to acknowledge that preparedness and global health security is a problem for the entire world and not just for low and middle-income countries. And I think, even you've all seen the measures of preparedness that came out, some better than others. I think in the end, the Global Health Security Agenda's joint external evaluation was pretty well correlated with how things have gone to date in the response to COVID-19. But even if a country has been ready conceptually from the perspective of these indices, we've seen many countries struggle to execute basic preparedness functions, things like surveillance and testing, and the development and deployment of basic countermeasures. Thinking that it's someone else's problem, the World Organization's really not prepared to respond at scale despite a lot of preparation. There is some speculation that maybe if it had been a pandemic influenza, things would have been different. And that's possible, but it's also possible that we would not have had such an efficacious vaccine in that case. So, and then we've also seen the problems with equity and speed and response. If we were talking about a pathogen with greater than a 1% case fatality rate, of course, there are ranges depending on all kinds of factors, but, in general, this was COVID-19 had a 1% case fatality rate. What if we had a 20% case fatality rate and similar kinds of transmissibility? I think we all understand in a really personal way now what that would mean for our lives. The other piece that I just want to flag that most of the panels and commissions have also noted is that the pandemic risks that we see, the frequency of emerging pathogens, seem to be increasing in frequency and severity over time. And that's not just because we've gotten better at tracking, but because of climate change, deforestation, the loss in biodiversity, food insecurity, all of those, and interdependence, obviously, in trade. Those things are both obviously some of those things are great for the global economy, but also represent a changing world and changing circumstances. So I think that's important to keep in mind before talking about what's needed. I think when we look at preparedness financing, or the composition of preparedness financing to date, basically, in most countries, they don't track spending on this use. They don't track even spending on public health in general. In the OECD, we have a category called public health and preparedness. That share of public spending has remained totally flat over time up until the last 2 years, when you can imagine that it's increasing enormously. But actually, if we looked at, we don't track this in low middle income countries, so it's hard to say what's going on. But we do know that in terms of how aid is used for these functions of surveillance, for these functions of research and development, for the development of medical countermeasures and their deployment, prior to COVID, it consumed, there are different kinds of estimates. Let's say the IHME estimated 2% of global health aid. The Georgetown Health Security database had a different kind of definition and classified about 10% of expenditure. The OECD has its own estimate, but it's all, pretty marginal compared to the total spend. Most of what we spend on is response to existing infectious disease threats. Of course, there's surveillance as part of that, but it sort of wasn't enough. I think it's clear. So sort of faced with that issue, the other point is that in low and middle income countries, obviously they have huge demands on very scarce public resources. Many even middle income countries don't do so well at early detection of diabetes and its treatment, and that's highly prevalent. And so the idea of spending a lot of money to track a might occur event is not really good economics and doesn't really make sense for those low and middle income countries. And that's one reason why the panel, this G20 panel, for example, really talks about the importance of what they call international financing, or external financing, so that these countries have some complementary assistance to pay for this. There's not going to be domestic demand for scaled up genomic surveillance of emerging pathogens in sub-Saharan Africa. If there is, fantastic, but it's, it just wouldn't necessarily make sense given the scale of demands that exist on those health systems already. I think the other thing to consider is that a lot of these things are global public goods. We call them that because they benefit those of us living in high income countries and middle income countries and low income countries. The signal from South Africa with Omicron gave important weeks to high income countries to prepare, because they're, obviously the profile of their populations was different, but we see how interdependent we are and how useful it can be to have early warning when that's possible. So all of that also to say, so there is that incentives issue that you were referring to, and I think, it's great to have new financing, and I can make the case for new financing, but what's also important is to have the framework and the incentives in place to be sure that the financing is working in a way that we think is helpful, right? So if there were a pandemic treaty, for example, or even with the existing international health regulations, money should be used to help meet those standards that all countries have agreed, right? And there's also a really important role for accountability mechanisms alongside, or independent verification of whether countries are meeting those standards. I think, do you want me to talk? I think I'll wait to talk about sort of who gets the money now and how they use it, and what that means for what happens next, for our next round of questions.
Thank you. Yeah, maybe we can get Kate in, and then we dive a little bit deeper on the different topics. Kate, there's and we heard it, the idea of creating a new financing mechanism, the fifth. Maybe you can explore a little bit on that, and also let us know a little bit what you think about the strengths, weaknesses, opportunities, risks, and also if we really need something new, or if we can build on the existing financing mechanisms that we have.
Thanks, Maike, and thanks to Amanda and Bjorn for really great scene-setting interventions to get us going. It's a pleasure for me to join this great group, and looking forward to the questions as well. I think I'll start, because we haven't kind of scene set specifically on the fifth yet, and I do think it's worth diving in a little bit about that. Amanda was a key part of the G20's high-level independent panel on the Global Commons for Pandemic Preparedness and Response, and that and what she just said clearly makes the case that the world is underinvesting in preparedness, especially, but also response capacities, readiness capacities, et cetera. And in that case is compelling. It's well documented, as Amanda also pointed out. There's supplementary analysis and modeling about the potential scale of underinvestment, although it is hard to pinpoint, right, and be highly precise about that. Previous pandemics told us the same, right, or previous epidemics. There was several review panels after the West Africa Ebola crisis that came to similar conclusions about things that Bjorn talked about that the global community is presently working on: strengthening WHO, especially its normative and technical capacities, supporting governments to make stronger kind of whole of government, whole of society response efforts, and frankly, preparedness efforts as well, leveraging greater financing, et cetera. Similar themes, we've debated around for multiple years. So I think the rationale and the need for incremental financing is clear. As Bjorn pointed out, though, it's almost a dizzying number of processes underway. And you can imagine for a government like Germany, there's capacity to sufficiently engage in all of those processes. In an inclusive kind of decision-making forum and process, like the intergovernmental negotiating processes at WHO or in other parts of the UN system or even the bank, small governments, small island developing states, least developing countries, they're going to really struggle with this dizzying array of processes. So there is a need to kind of rationalize, bring coherence, and try to elevate the highest priority and most ripe opportunities for change. The proposal for a financial intermediary fund, which as Bjorn laid out, was brought forward through the G20 high-level independent panel's work last year, but then kind of the mantle carried forward by the US government and Norway, among others, and that kind of circle has widened of protagonists for this concept, is an attempt to really kind of cohere and align around a specific opportunity, an opportunity that would be hosted at the World Bank to leverage its capacities to engage countries, to stimulate and incent on-book financing, as Amanda mentioned, is really critically important, but also could tap a wide diversity of financing to be additional and incremental to try to reduce that gap that Amanda pointed out and talked about. And I think those are the key opportunities, right? If designed well, a new FIF could be incremental. That's hard, and it's certainly not guaranteed, especially if there's a kind of a fair share model, to simplify, like kind of a dues-based model where all governments should be contributing to their fair share. And especially if we're trying to stimulate non-ODA financing. It's potentially, it's an argument that parliaments are used to hearing, and heads of state are used to hearing, that they think about global health in ODA terms. What a fifth has the potential to do is to reset a conversation that this is about global security. And this is about the security and well-being of people around the world, right? It's a common goods issue, so it shouldn't be financed by ODA. But actually making that step and being able to make the case to governments that it has to be non-ODA financing in order to be incremental and not just rob from one account for one towards another priority, that's the worst solution, and that's a big threat and a big challenge. But if it is truly incremental, I think it has a real game-changing power. The other pieces that I'll point out, I think allocation will matter. Amanda talked about the gaps that are already out there at country level that we clearly know, but how this instrument allocates its financing to support preparedness efforts at country level, as well as regional and global public goods, how it can leverage and support regional efforts like the African CDC, global needs and norms like CEPI or the Berlin Hub on Epidemic and Pandemic Intelligence. Those are global common goods that are clearly necessary for true preparedness at a global level. Where and how this fifth allocates its financing, I think, is really important. We've talked a bit about the myriad of kind of institutions that are already in the global health ecosystem that are working day and night to try to achieve the health-related sustainable development goals and support countries, right? Gavi, Global Fund, CEPI, UNICEF, WHO. It's kind of acronym soup. But I think the challenge of a fifth, if it adds complexity to that and bureaucracy to that. But the flip side is it could be an opportunity. It could be a way for each of those institutions to be supported to their comparative advantage. And if it's done well, I think it does that. And it helps bring that kind of alignment and unity of purpose on the agenda of preparedness, right, to the existing global health ecosystem. So I think that, you can turn that potential risk into an opportunity. The last thing, and just to lift up, because Björn already talked about this, is a fifth can't be the only solution. It can't be the only preparedness solution. It can't be the only solution that receives incremental financing, right? There's a set of replenishments underway that are not just to satisfy the kind of preparedness and pandemic related functions where in comparative advantages and work that a CEPI or a Global Fund or a Gavi could deliver on. Those institutions have vital functions, beyond just in the context of a pandemic, and their resourcing needs are acute and important, including to help countries, recover and kind of re-accelerate and reignite progress on the health-related SDGs. But foremost, I fully agree with Björn that any set of new financing that, is able to be stimulated this year and beyond that does not include WHO is a real missed opportunity. WHO's by dues. That puts the entire organization at risk of not having the capacity needed to both help countries better prepare, the kind of technical support that it can give to countries, but also to respond. And WHO had to tin cup at the start of this pandemic because they didn't have the resources they needed. The contingency fund for emergencies was less than half full when COVID struck. And that's a challenge. That's a challenge of global public goods, global common goods. And as Björn said, the outlook on that and whether member states will, sufficiently meet the need and opportunity to address this issue and create a pathway for more sustainable financing is not certain. I'm an optimist. I think we'll get there. But any kind of larger solution like a fifth that is not accompanied by strengthening WHO is a real missed opportunity.
Thank you, Kate, also for broadening the conversation, not only to talk about one specific financing instrument, but the broader sense and also focusing on WHO. Björn, you mentioned it already, and I think we could dive in a little bit deeper into financial incentives, especially for high-income countries. WHO struggles already in raising funds, as Kate just told us. What would be different with any new instrument, and where are the incentives for especially high-income countries, or maybe also non-state actors, to increase financing of pandemic preparedness and response?
I think thanks a lot for the question. So I think the question on incentives is key, and I will come to that in a second. But one aspect I think that is that we need to be aware of, and I'll bring it up because in my capacity as a chair, I've been having the pleasure and honor to be in Geneva. I was in Geneva last week in order to see the positioning of lots of member states. So I was practically in I don't know how many missions and met lots of ambassadors in order to see on the financing of WHO, where they stand. And obviously we also included, when you're discussing financing for WHO, you're always discussing also the broader picture, so the fifth and others, etc. And there were two notions, they came up practically in all discussions, and I met practically all geopolitical powers you have to name. So practically the first main theme was, this is now or never. There is this overall notion, if we don't take decisive steps this year, and also in the WHO, this year means practically in May, at the Assembly in May, which is not, which doesn't leave us too much time, then there will be no decision at all, because everybody doubts that next year or the years after that, we will have the political dynamics, the political momentum for real changes. And we've seen that after the West Africa Ebola crisis, that practically right after the crisis, everybody was in for real change. But since other crises, obvious geopolitical crises come up, and we see that already, the political focus shifts, and the real political decision makers on the top level, they will not focus on a pandemic that happened in the past. Yeah? And the next one might happen only in 30, 40, 50, 60, 70 years. So this is not in the key focus of many decision makers. So we need to use the momentum now in order to get this right. And we need to get it right, and we need to design it well. So that's the first main theme that came up in these discussions, practically from also, well, from be it industrialized countries and developing countries and emerging economies. But the second one was the theme of inclusivity. And you were asking, what is the difference between WHO and other players? Well, there's one key difference here. The one key difference is that at the WHO, whether we like it or not, there are 194 member states sitting at the table and taking a decision all together, normally in consensus. And practically that's part of my day-to-day work, multilateralism, everybody sitting at the table. And sometimes you like your neighbor and sometimes you don't like your neighbor, and you have challenges engaging for other geopolitical conflicts. But everybody sits there and everybody together takes a decision. That makes WHO quite unique in the global health arena. If you're looking at other fora, not everybody sits at the table. Now, my government has the pleasure to be sitting at most of the tables, be it G7, G20, or most of the other boards, Gavi, CEPI, Global Fund. But talk to the colleagues, I spoke to the ambassador of Morocco. Yeah, where is Morocco sitting? Morocco is sitting in the WHO, but not in the other fora. So what we are financing dictates, well, or more or less shapes who is part of the decision making. So if we are strengthening the WHO, we are strengthening the multilateral decision making with 194 member states at the table. And obviously the decision making is sometimes quite difficult with 194. But if we are shifting to other fora and putting more or less the financial impetus to other fora and not strengthen at the same time the WHO, the lead agency of global health, which is supposed to coordinate everybody else, but is unable to do so because of lacking financial resources, that affects the big theme of inclusivity. Not everybody will have the same say as others. And I think we need to be absolutely aware of that. It might not be something that we are often aware of because we might be sitting at all these other fora, but the developing world certainly looks at this. And that's also a challenge, because I'm focusing, I also read all the responses in G20 with regards to the fifth, and we often hear that many G20 countries are reluctant and they point their fingers. They rather want to strengthen WHO and they rather want to have the sustainable financing for WHO. The tricky part here is that in the working group that I have the pleasure and honor to chair, the same member states then say, well, sorry, but we don't have any resources to strengthen, and they practically, some of them even block the financing of WHO, which could end in moving nowhere and losing the political momentum. Where do the incentives come in? Well, I think there's one key game changer when it comes to pandemic preparedness and response that was already introduced after the West Africa Ebola crisis in the Kick-Beta report, but has never been implemented. But it's now practically in the discussions, at least in Geneva, which is to introduce a new universal health periodic review mechanism that practically assesses the level of preparedness and response on a country level. And based on that, in the WHO mechanism. And based on that, I think Kate and Amanda were also focusing on the allocation mechanism. This certainly could be the basis of an allocation mechanism, linking potentially a fifth with a truly enabled WHO, playing a key role in the new UHPR mechanism, this Universal Periodic Review mechanism, assessing the country needs in IHR preparedness. I think that could really be a game changer and a tool for incentivizing the establishment of the IHR core capacities, because that was lacking until now. The IHR are a great tool, but they are lacking an accountability or incentivizing mechanism, which I hope we are creating now. And if we were to link both, I think we would also find a nice solution to the issue of inclusivity. So that's at least my hope.
Thank you very much, Björn. Amanda, would you like to come in on this?
Yeah, so I think there are a couple of questions in the chat as well that I can speak to. You know, the other very inclusive organization that's part of this puzzle is the World Bank, that has 189 member countries. Of course, there are borrowing member countries and non-borrowing member countries. And they have different weights on the board, unlike the WHO, that's one country, one vote. But that has some role with the money that they give. You know, I think we have to acknowledge that. So, you know, just to say there's a family of global institutions, and I think the idea that I think that the panels put together and that I share is to better think of this as a package of financing that's required in the wake of COVID-19 to reform and reinvest in global health, right? Starting with the World Health Organization, a very modest ask, actually. In our earlier report, we had written $1 billion additional in assessed contributions every year, but I see it's actually somewhat less than that. This is something eminently doable, and it's over a very long period of time, but it sends the signal that the WHO plays a very important stewardship and coordination role in addition to the other things that it does. And it should be adequately financed also in its contingency fund. We see again and again, you know, WHO does do that first deployment of epidemiologists and investigators when an outbreak happens. And it's always, again, the tin cup mode. That, you know, obviously most countries can agree that this is an important function, and it's the only function that exists today. So I hope that we see, so that's a big part of that package. The second part of the package, as we said, was the replenishment of the existing institutions, including the requirements associated with Act A. You know, unless the plan is, I think there could be a very valid discussion on whether we should continue to finance medicines that are affordable for domestic governments, things like first-line antiretrovirals. These are medicines that are part of basic health care and that one would expect low and middle-income countries to be able to finance on their own. So we could talk about maybe the composition of what the Global Fund finances could change over time. But in general, as long as we think these are good things and they work well, let's stay the course. That's 30 billion a year. And then we add our additional, you know, 1 billion a year and our Act A. And then the final piece I do think is this financing for pandemic preparedness. I would distinguish between what happened before the Pandemic Emergency Facility, which was a facility created at the World Bank that also had Germany's participation. And that was mainly a response mechanism. It was intended, it was an insurance policy that was intended to trigger money when an outbreak became a problem across borders. It turns out that it's quite difficult ex ante to set up triggers that are meaningful in time at this stage, especially when you're talking about a novel virus. So the insurance part of this, it did actually put out money, but it arrived late, it was insufficient, etc. The PEF also had a cash window, e.g. trust fund money, that did go out and actually made a very important difference in the second DRC Ebola outbreak. I don't think the PEF is the model for this pandemic preparedness and response financing facility. And I think one of the discussions that one could have is around, you know, should this be modeled after a global environment facility type FIF, meaning it would sit outside the World Bank. It would have its own governance, and it would give money across both the multilateral development banks and the Global Health Organization system to achieve preparedness goals. Or the inside the World Bank option, okay, where we have a couple of different experiences to look at. If you think about the role of the bank in climate, for example, versus the role of the FIFs in climate, one thing we can say is that the World Bank itself spends much more than all of the FIFs put together in getting climate finance to low and middle income countries. But it doesn't work so well with those FIFs on the outside. So I guess one question is to make sure that whatever we come up with, it must work to leverage the bank financing, because all of this is not going to be financed with grant monies, right? And the governance of the board can oversee that money. And I think one other thing we've been talking about with colleagues at the BMZ is the idea of the bank itself needs to reform to not only serve its poverty reduction mandate, but to add a mandate on global public goods, which should be climate and pandemic. And if that happened, then we can also access other sources of money and fundraising and leverage that the bank has available to it inside the bank. These are all still ideas and discussions, but I think it's an important thing to think about. In that sense, it wouldn't be a new organization. It would be a reformed organization that serves these purposes, right? And I mean, these has to be subject to negotiations, but I believe that would be consistent with the spirit of what the G20 proposed and what the G20 is discussing right now, and should be, I think the big question is, how do all these things work together? And we've seen that at the start of COVAX, the bank could have provided the guarantees up front to enable the advanced purchase of vaccines sufficient to cover the entire low-income country world. Why didn't that happen? Well, there's lots of different reasons, but one reason is that they don't have a mandate to do, not an explicit mandate to take those kinds of risks and to work jointly with the global health organizations in that space. And so, at least we can get that done for the next time, so that the money moves more quickly when we need to do those advanced purchases. Thanks.
Thank you, Amanda, and also for raising the question, or the state that it's a question of who has the mandate and who can give the mandate. Kate, maybe you want to answer the question Amanda just raised. How do we get things working together? And explore also on the questions raised in the chat. Maybe you want to go into also on the pandemic emergency financing facility and the questions. I think there were 2 questions raised on this, one from Marvin Meyer. What are the lessons learned that Amanda also mentioned, and maybe you want to add something?
Thanks, Maike. I'll let Amanda's feedback and kind of lessons on the PEF speak for themselves. It's actually something that I haven't followed quite closely, but learned a lot from what she's shared about some of the challenges and why it was an imperfect solution in the context of this pandemic. So I think we should certainly take those lessons to heart. But it is not an easy question to answer, and there's no panacea for how do we kind of think more coherently and rationalize these various opportunities and challenges. And I appreciate some of the comments in the chat as we were talking about allocation before of a potential fifth. As Björn noted, there's a need to kind of allocate fairly against kind of assessments and benchmarks, and the concept of a universal health and pandemic periodic review is a really compelling one, because both the JEEs are incomplete, but certainly that has a role to play as well, and the kind of incentives and the way that a future financing mechanism plays with a pandemic treaty is really important. But still, as Arush pointed out in the chat, there's a real need to think about how to make incremental financing at all levels multi-use, dual use, or at least dual use, but clearly multi-use in supporting country needs, right? There's a potential for a high degree of fragmentation to emerge through all of these conversations, and how financing gets deployed at country level if we don't take those larger needs into account and are designing kind of individual stovepipes or continuing to finance just an individual stovepipes and not actually looking at the kind of broader needs at country level and how the different financing streams that emanate outside of a domestic budget can be supportive of an integrative set of needs. And I do think this still seems like open question around issues of kind of thinking about health workforce as being a frontline health workforce as being a part. It is clearly an imperative to achieve UHC. How do we make the case of what portions or all of frontline health workforce needs that need to be supplemented outside of domestic financing should be supported through a fifth, or should be supported through other financing instruments? I don't think the global community has really sorted that sufficiently and are really using this moment in time to kind of flip the rationale and start first with those country needs and then build the kind of complementarity and kind of coherence of financing to match that. And I think that's a real risk. And it comes back to the decision-making table, as Björn already talked about, right? When a government like Morocco doesn't have a seat at the G20 to talk about the design of a fifth, then it may risk not being built on those country needs. So inclusivity in the design of, these next set of solutions is an imperative, but that's not easy either, because as I mentioned before, if you're a small island developing state, you are lucky to have one person looking at health issues in your mission in Geneva. Some may not. They may just be focusing on trade, or they may just be focusing on other issues, right? And so how do they really have a seat at the table for, 3 deep dive sessions of the WGPR that are happening concurrently as the Sustainable Financing Working Group that's happening concurrently as the intergovernmental negotiating body, and that's actually happening this spring? That's hard. And also thinking about the World Bank spring meetings and the points of view they bring to there. The independent panel on pandemic preparedness and response kind of recognized both the need to foremost invest at the community level, because that's the front line of preparedness and response to health threats, right? And that was a clear narrative that came out of their work that was submitted to the World Health Assembly last May. But they also talked about the need for political leadership at the highest levels in the global community to try to help bring this coherence, right? It's easier to kind of look at the big picture when you're looking at it from the vantage point of heads of state and government, trying to think across the suite of opportunities and needs as a complement to the very essential technical kind of negotiations and conversations that are happening. And I don't think we've seen that happen yet. The G7 and certainly Germany's leadership in prioritizing these issues in the context of the German presidency of the G7 is important, but as Björn said, is not inclusive, right? So is there a complement to be able to do that using the WHO, using the larger UN in New York? That's the panel argued that it should be at the level of the UN in New York to inspire a head of state response and a head of state kind of coherence to this entire agenda.
Thank you so much, Kate. So many thoughts in my head, and thank you also for picking up on some questions raised already in the chat box. Maybe we can move a little bit towards the pandemic treaty, Björn. There's a question also from Jan Detering, and maybe you can help us out there a little bit, since internationally a new pandemic treaty is currently discussed, and with it also financial incentives to strengthen pandemic preparedness and response. How could this fit together? What is the legal frame that's currently being discussed? And maybe you can give us a brief intro into the pandemic treaty discussions.
Okay, a brief intro. That's challenging. So first of all, this idea about a pandemic treaty came up or was brought up by Charles Michel. Although there's a fight in between Charles Michel and the Chilean president who brought it up first, but it was introduced. So practically the main reasoning behind it is that there was this overall feeling that there is no legal or that there was no legal clarity before this pandemic hit us. And one of the key lessons, I think, is that there is a need for more legal clarity. What are the state obligations in also international response and preparedness with regards to obviously a crisis like COVID. The World Health Assembly decided to set up a special assembly last end of November, December, 4 months ago, in order to decide whether there should be a process leading potentially to a new instrument. And the one thing that is and remains highly controversial, whether it should be a legally binding instrument, a treaty or agreement, or any other form. And there are diverging views, let's put it this way. Although I think the broad majority of member states believes that we need legal clarity, and therefore we should really aim for a very ambitious treaty. However, I think one of the key concerns that I also personally shared was to some extent this discussion was discussing a shell without substance. So practically we were discussing the tool, what tool do we need, but in order to tackle what concrete contents, and that remains unclear until now. So there are lots of things that different member states want to tackle within this long process, which will last the next 2 years, but it's unclear yet. The INB, the International Negotiating Body, was established and met already once. It will reconvene mid-March, around the 15th, I think, for 2 days. But that obviously will not be the last meeting, but then meetings will proceed. But we assume that in between March and then potentially July, there will be discussions and there will be more clarity what will be tackled in the pandemic treaty. Obviously, things like pathogen sharing, equity will be key. There was also this idea to include a strengthening of the international health regulations, the IHR. However, there is a parallel process happening now. So the IHR will be strengthened alongside the pandemic treaty discussions. And there was at the very start the idea to also include the financing for pandemic preparedness in the treaty. But to be honest, this discussion hasn't really picked up. So potentially we will see it coming up again. There was this notion of also including the sustainable financing for WHO in the treaty debates, but that has, I think, that will not be included, because obviously the members to a treaty can be different than the members to the WHO, and I think it would be getting far too complex if the financing debate, at least for the WHO, would be included in the pandemic treaty. Now, I think I'd like to link it to two notions that Amanda and Kate brought up, and also you, the broader picture. So I think the best idea, if we were to design it in a scientific panel, would be, let's create an overarching treaty or framework and clarify everything in this framework, including the financing of all different important organizations, potentially their mandates to make sure that there's no duplication, the coordination, clarifying that there's no fragmentation, etc. So practically the overall picture. That would be the best idea, yeah. But the end result would take place potentially only in 2 years, if we ever get there, because obviously many of these things could be highly controversial. But what I said up front is that the political momentum to really move forward and to really, get innovation on the way might be gone in 2 years' time. So I think we are running and we are fighting against the clock. What we certainly lack is the overall picture, is the putting all these different puzzle pieces together. How does the fifth fit into the overall framework of all the different actors that already exist, in the strengthening of the IHR, in the new game changer, as I mentioned, the UHPR system, in a hopefully strengthened WHO, the directing and leading authority. How does this link to with one another? And I doubt that anybody has a clear picture here. I think that this would, I think, from my personal point of view, have been the best way to start off there, to start what global health architecture do we envisage post-COVID, and then design practically what will be the financing tool for it, who's in charge of what, how do we differentiate in between the mandates of those many actors already there, Gavi, Global Fund, CEPI, WHO, and all the other ones. But unfortunately, that is not the way we are approaching it now. And I doubt that we can revise practically the clock here. So we need to work with these ongoing trends and try to make sure that in the end, this makes a nice picture and is well coordinated.
Yeah, thank you. I mean, there are clearly path dependencies that don't go away overnight. So as you said, we have to work with them. I've been working on the pandemic treaty for the past month with some colleagues. And I think what needs to be answered is what is the problem that needs to be fixed with a new pandemic treaty and a legal instrument. And as you said, the shell is basically being decided, the form of the new instrument, but what is the content? And there's also a question in the chat box, and maybe Amanda and Kate, maybe you have the big idea for the content and maybe you want to share. Kate, maybe you would like to start.
Well, Björn mentioned equity, right? And I think one of the clear, you can almost feel it, rationales for where a treaty can solve for that this pandemic has clearly presented struggle in the international communities is access to countermeasures. And it vexes all of us that we are where we are in the supply of countermeasures and who's gotten them first and who has to wait in line. And it's not driven by public health considerations. It's driven by ability to pay. It's driven by lots of other reasons. So a pandemic accord, this is no easy task, but that could address issues of the kind of norms around equitable access to countermeasures, which, I mean, remember in the spring of 2020, this is not just about vaccines or new therapeutics or whatever, novel therapeutics. It's about the basics like PPE, right? And there will be finite supply in the context of a pandemic of countermeasures, right? There's essential and important work that needs to be supported on increasing and diversifying manufacturing capacity around the world as a way to try to mitigate against supply constraints and potentially against access constraints. But a treaty, I think, is a compelling way to think about can you create a new set of norms and obligations that guide the access to countermeasures. So that's clearly one. But where I'll let Amanda, if she has other thoughts here, just so that I can be brief, speak to some other potential opportunities.
Thank you, Kate.
Yeah,
Amanda, please.
So, I mean, I am a little worried about the pandemic treaty, honestly, because, I mean, like, just to take an example of one key issue, which is sharing of genomic sequences, that seems vital. And we don't want to go back from the pandemic influenza framework that exists. That is functional. And industry is there, the country governments are there, their sharing of information, unfortunately, didn't apply to things that were not influenza samples. And I mean, we sort of muddled through this time, but there might be some virtue in being more modest and saying, like, and even to renegotiate the PIP framework is complicated, but is there something from the PIP framework experience that we could build on and have maybe some core things that we really want to get done, and then the other stuff that would be great. I really think the access to medical countermeasures can be fixed with the right financing. I guess, of course, everyone declares that there should be equity, but when the rubber hits the road, people are taking their procurement decisions the way they're taking their procurement decisions. So I think, just having there's going to be a paper coming out shortly from some colleagues at the IMF and the World Bank that really show that it's really about, it's very simple. Order early, get early. and COVAX was not able to order early. It just wasn't, and the money was not in place in sufficient amounts. So, I think we just have to think, I don't think it necessarily has to be COVAX, it could be regional entities. And I think in the chat, Austin is from NORAD is really making a hugely important point, which is that if the global mechanisms weren't prepared to act this way, maybe that they've lost some credibility in this process, and the regional entities are the ones that would take it forward. Maybe there's some cooperative way ahead, but I mean, people will vote with their feet in terms of where they put their money. So I guess I'm a little worried about the pandemic treaty is what my bottom line statement. So I was glad also to hear about the universal periodic review mechanism. I think that's good, and to the extent there's standards, to the extent money can be in place to support the achievement of standards, I think those things are doable, and they're doable in the near term without a huge amount of controversy. We could be in, a decade of negotiations with the pandemic treaty. So I think we need to think about, well, what do we do in the meantime?
Exactly, and how to build trust in the meantime to have a negotiation process for the pandemic treaty. Björn, I would like to dive into this a little bit deeper, coming back to incentives. What are the incentives for high-income countries around the pandemic treaty, and what are also financial incentives in the sense of the results of the UPRs? I think financial incentives are not so interesting for high-income countries, are they?
Well, hopefully they shouldn't be, because high-income countries have high income, so indeed they should not have an interest in receiving funding themselves primarily. But high-income countries have an interest in making sure that the IHR core capacities are implemented throughout the entire globe. And therefore, I think there is, or my hope is that the pandemic treaty, if it is successful, would offer, linking these incentives, that it practically is a give and take, a benefit sharing, and we offer practically a compliance mechanism, making sure that the IHR are being complied to. I think that the sharing of data is a key thing. We mentioned already the sharing of pathogens. I think that the PIP framework is certainly, or could be a great example that we should look at, because it indeed, as Amanda was alluding to, is something that seems to work fairly well. I think some further aspects are being discussed and not surely looking or primarily looking at a usual pandemic, but also AMR is being discussed as potentially being included in the pandemic treaty. So practically the pandemic, the forgotten pandemic. And I think there is huge merit in exploring further this. So, and I think, again, there, high-income countries certainly have a huge interest. I think, as we said, the sharing of data and sharing of pathogens is in the interest of us all, because even before the question comes up, how do we make sure that everybody has access to countermeasures? They have to be produced, they have to be invented, we have to ensure innovation, and that is impossible if there's no sharing of data and pathogens, obviously. The tricky part about the pandemic treaty is that we have these parallel processes at this stage. There was in the negotiation at some stage this either or. Do we do an IHR strengthening of the IHR, or do we do a pandemic treaty? And the German position was we have to do both at the same time, because we don't know whether any of them will be successful. So let's explore both. And often the question comes up, where do we put, for example, the strengthening of the compliance mechanism, the UHPR? Does this better fit into the pandemic treaty, or does it better fit into the IHR strengthening? And practically, we take a quite pragmatic position. We don't care as long as it's been implemented at the very end. Yeah. So we need to make sure, and I think that's the biggest risk at any of these debates, be it the pandemic treaty, be it the strengthening of the WHO, be it the new financing facility. If at the outset, there's a huge consensus among practically the entire world that we need to learn the lessons from this pandemic. But when it comes to concrete proposals, the consensus shifts away. And you see this in practically every single bit. fifth, strengthening of the WHO, strengthening of the IHR, a compliance mechanism, etc. And we need to make sure that, well, we are practically harvesting the great ideas and great inputs that we've seen in all the different panels, be it the IPPBR, the G20 high-level independent panel, and all the others. The one lesson that we learned from past pandemics is that normally we know what to do, but for some reason we don't use the political momentum, and we practically don't use the short window of opportunity to truly implement them. And the risk, or the reality is, the risk is quite high that we will go again the same route, and that we are missing the opportunity to implement any of those unless we all push for it on all these sides. Obviously, making sure that they are well designed and that we are not implementing something that doesn't make sense. But I think most of this certainly makes sense.
Thank you, Björn. I mean, I think there is consensus on equitable access and distribution of countermeasures, but what does it mean in detail in different contexts is completely differently understood. And I think this is, equity is a word easily said, but what does it mean in context? Amanda, I think I saw your hand.
Well, just to go back to the point about other events overtaking the sense of urgency. I mean, we've seen the past week what's happening in Ukraine, and a huge mobilization of budget, including in Germany, $100 billion overnight, okay, to respond to a clear and present threat. And what we are asking for with this package of measures, right, which again is WHO assessed contributions increase very modest. Global health organizations, the existing ones, Replenishment plus Act A to those same orgs. And then some dedicated money for financing preparedness, an additional $10 billion a year. We're asking overall for an increase of $10 billion a year. Maybe next year we need $50 billion, but after that it's $40 billion a year. It's nothing. It's nothing. And this is an existential threat as important as the Ukraine conflict. And so for me, I think if we could, as a community, hang together and come with the package and argue the package at the G7, at the G20, and everywhere else, and then with the long-term view with the pandemic treaty and the accountability mechanisms, maybe we get through. I do worry that we spent so much time quibbling amongst ourselves about, the different pieces of, who does what, that we've actually taken the enthusiasm out of the, we had finance ministers interested, and because we're like, well, no, and I do that, and this other person does, well, let's figure that out later. Let's just get the big ask done this year if we can, before the opportunity disappears altogether. So thanks.
Thank you, Amanda. There are a couple of more questions in the chat, and I would like to raise the last one from Arush Lal. Maybe Kate, this is for you. There are elements of Act A that should be sustained to help ensure rapid coordination and mobilization for countermeasures in the future. Maybe we can talk a little bit about Act A in general. Kate, would you like to start?
Absolutely. And thanks for the question, Arush. I do, as Amanda pointed out, I think in a previous intervention, the ACT Accelerator and frankly, a lot of our collective response in this pandemic was kind of muscled through ad hoc as the crisis hit. And as the global community kind of recognized the gaps in our response, and the ACT Accelerator was a big part of that, right? There wasn't kind of a set of norms, standard operating procedures around how to coordinate on novel countermeasures and existing countermeasures like PPE. In the spring of 2020 is when the ACT Accelerator was formalized and kind of launched. But at that same time, WHO and WFP, together with the Global Fund, UNICEF, others who do large-scale procurement, came around the concept and developed something called the UN Supply Chain Bridge Facility or Supply Chain Service. And the idea was to create a bridge facility because countries, low middle income countries, frankly, many countries, but especially low middle income countries couldn't access PPE, right? Their dollars were not they couldn't muscle enough dollars in the open market, and there wasn't transparency around how PPE was allocated. So they rapidly designed this effort to stand up a pooled procurement for PPE. The COVID-19 Solidarity Response Fund that you mentioned in my introduction is something that I led over the course of 2020, was the first big investor in that supply chain bridge facility for PPE and testing commodities, related commodities. Without non-traditional donors rapidly muscling in, it wouldn't have been established in the spring of 2020. And I think that's a key gap in thinking about what can be solved in the future, is kind of at the ready financing that, as Amanda said, maybe it's the bank that could be deployed as needed to make sure there's access to market for countermeasures, including PPE. But back to your question about the ACT Accelerator more generally, I think there's a huge contribution, obviously, that the ACT Accelerator and its agencies have made in terms of accelerating equitable access to novel countermeasures, especially, but countermeasures in general. And we shouldn't overlook that. As Amanda said, just in the context of thinking about the larger package of needs, let's not cut off our nose in spite of our face and quibble about the relative performance and performance improvements of the ACT Accelerator, because if we didn't have it, think of how much worse off the world would be in terms of access to these countermeasures over the past 18 months or more, and certainly as it's still needed, right? We have to acknowledge that this is a great mechanism, that for COVAX delivering 1.2 billion doses and counting in a different environment, would that have at all been the potential result? And so let's make sure that we're supporting it to do its best work, and also acknowledging the work that the ACT Accelerator and its partners have really delivered on. I worry, though, that about this whole notion of we're at this unique political moment and we have the opportunity to galvanize real change. I believe it fully, but I don't think it's secured, right? We've seen in the context of Ukraine how much, frankly, faster the global community can mobilize against a threat, and mobilize financing as well, but also political leadership, sustained political leadership, day-to-day conversations at the heads of state level, right? We haven't seen that in this pandemic. And I think the ACT Accelerator's persistent financing gap, the fact that notwithstanding Germany's really essential new announcement of $1.5 billion in recent days to the ACT Accelerator, most countries are not meeting their fair share. There's still a gap in the ACT Accelerator financing. The case cannot be more clear that this is one of our best solutions, in additional to interregional means, like in the African Union, but we still can't muscle enough financing. And with most of the financing that's been deployed to the ACT Accelerator has been ODA. And that's, I think, a systemic challenge. It's a real lesson as we think about a fifth. How do you create the incentive for non-ODA financing when we can't muscle it now in the context of a real pandemic?
Thanks so much, Kate. We are soon coming to an end, and I would like to give you the opportunity to look a little bit into the future with me, and maybe we can explore the question on concrete next steps for pandemic preparedness and response that includes financing. So who should be doing what now? And of course, you are speaking to a German audience, and maybe also some colleagues from Björn in the German government being responsible for the G7 process. So please keep that in mind, and maybe you have some recommendations for them. Amanda, would you like to start?
I have so many. Okay, well, one is what we've talked about, to present the package of needs together, and to use that as a way to, just the G7 would be half on money. The same 14 governments finance all of these mechanisms. I think that's something that I learned while doing a paper a couple of years ago. And so, if we did get the G7 on board, at least on the money side, of course, we would like to see different kinds of participation from China and India, But okay, still the money, if we could get that package through the G7, I think we would be in business. Then there's the process parts that we need to be much more careful about and inclusive in conversations and things like that. But I do think there's a moment to sort of just put these thoughts together and not negotiate them all separately in all the different separate venues, given that the bulk of the money will come from Germany, US, UK, France, Japan, etc. So that's one thing. The other big reform, I do think we do need to reform some of these institutions. The idea of adding global public goods as an explicit mandate to the World Bank's mission and to have that cover both climate and pandemic, I think is an idea whose time has come and enables you to use concessional resources in ways that leverage more and that enable more lending resources to governments. It's a way that the SDR could be channeled. And on the climate side, they have very specific proposals on that. We on the health side do not have specific proposals on that, but I think we could build them fairly easily. And I just feel like it would give a G7 deliverable that is so much more meaningful than we did a little fund here on climate and we did a little fund here on pandemic and then we did a little assessed contribution. No, we have to get the big picture a little bit here. And I think that hopefully could save us from being completely blown out of the water by current geopolitical events, which I think is happening anyhow. So I'm really looking to Germany with lots of hope and enthusiasm and excitement and ready to work alongside you to deliver on some of these things. Thanks.
Thank you so much, Amanda. Kate, would you like to step in on concrete next steps for pandemic preparedness and response?
Well, it's easy to come after Amanda because then I can just say like all of what Amanda said, please. I think those are key.
I'm sure you have more ideas.
Recommendations. No, but I think part of this this opportunity that we're in right now is dependent on, and I mentioned this a little bit in the context of the ACT Accelerator, putting down pointy elbows, right? To think about a kind of larger opportunity space on this requires not just niddling inside the global health community and rather lifting up with one voice, with pointy elbows down to really make the case at the highest levels. And I do worry in plenty of contexts that, including my own government at home in the United States, that this feeling that the pandemic is over, right? This moment is past. It's something we have to deal with. COVID is something we're going to have to manage for a long time, but we can't let that, derail us from, other priorities. And so that requires that kind of unity of voice and that unity of push. And I think, really clearly, right? Civil society, we didn't spend a lot of time talking about them in this conversation, but has a really indispensable role to play, not only in both preparedness and response to current and future pandemic threats, and I think have been underused in both contexts historically, but also in, rallying the global community to, let's make sure we do what's right. Let's make sure we take advantage of this moment and this opportunity. Citizens are powerful stakeholders and shareholders in their own governments and in other governments as well. And I do think that's something that we need to further harness and mobilize and support and nurture over this coming period in order to realize these goals that we've talked a lot about today.
Thank you so much, Kate. Maybe because we haven't really focused on it, you can add some sentences on civil society engagement and their role in pandemic preparedness and response. We have a couple of minutes left, so maybe you can dive into that.
Sure. Well, and I can do it in a number of different ways because I think, I already mentioned just, I think some general capacities and ways. But as we think more practically about some of these exact discussions that are happening in these, in these negotiations that are happening, we aren't seeing enough space for civil society at the decision-making table in these conversations, right? It's only, 4 or 5 months through the work of the working group on strengthening WHO, that non-state actors were invited to even listen in to the conversations, right? The intergovernmental, I will say to its credit, the World Health Assembly special session made explicit mention of the essential nature of engaging civil society and other non-state actor voices in the development of a future pandemic accord. So we do have high aspiration and expectation that the intergovernmental negotiating body, as it gets further underway this month, invites non-state actors to the table, and not just in kind of listening mode, but actually seeks out forms and modalities for active consultation and engagement, substantive interventions, and contributions from civil society and other stakeholders over the weeks and months to come. I have optimism that that non-state actors will be included and invited to observe the negotiations, but will they go that extra mile to engage and consult and seek input from non-state actors, especially civil society? I'm not sure, and I don't think it's guaranteed. So there's a lot of pushing to be done there. WHO, I think, has been going through, in the overall framework of its engagement with non-state actors, an overdue but important exercise in deepening, trying to think about how to deepen its work with civil society at all levels, country level, regional level, and at headquarter level. And that isn't just about governance and, in the way civil society or non-state actors engage in the World Health Assembly. It's about the day-to-day work that WHO country offices do and setting a table for conversation with governments around health priorities of all stripes, right? Not just in the context of pandemics. And can you include civil society? Can WHO enable the inclusion of the civil society in the policy and prioritization efforts at country level? I think is another key opportunity that's under leveraged. I think there are other parts of the UN system that do this a lot better. There are other ways, but it's not easy, right? The bank, if they're going to play a role, as Amanda has argued, in both the financing agenda overall, but in the kind of inclusive decision-making process of establishing new financing capacities and muscle on pandemic preparedness and response, what role do civil society have there in the decision-making table? We still have to answer some of those questions, right? But making sure that that's a priority, that governments who do have a seat at the table are including those non-state actor voices, I think that's a really important part of the equation.
Thank you so much, Kate, to explore this a little bit more. I know that German civil society, of course, is very interested in also engaging in all of these different initiatives. Björn, you have the last word, but we are, of course, very curious to hear your ideas on concrete next steps for your and my government and also for the wider global health community.
Okay, I was afraid of that pressure at the end. Okay, but I'll try my best. I think I completely share what Amanda and Kate have said, especially with regards to the package deal that we need. Yeah? I think I would add the package needs to ensure that, as I maybe coming back to the start, to my initial statement, that global health governance post-COVID is more effective, more inclusive, less fragmented, offers less duplication, and is best coordinated or as good coordinated as possible. Yeah, and ensuring that, which will be more or less quite a tricky task, but I think in the end it's doable. With regards to the money side, I think I completely share that if we compare the costs of this pandemic currently with the costs that are needed for pandemic preparedness, it's an easy investment. It seems like a very, very easy investment, and it's hard to argue against it, I think, from our public health perspective. But the reality check is when I'm just focusing on the peanuts in abbreviation marks that we need to establish or ensure sustainable finances for the WHO, which is practically an ask of $600 million per year by 194 member states. Well, what I hear from member states is fiscal constraints. They are unable to increase just 1 cent in addition for the WHO, which is supposed to be the leading and coordinating authority. And the truth is that among the G7 members, I could name 3, that are at this moment unlikely to go for an increase. I'm not going to mention who that is. So fiscal constraints, or at least the argument of fiscal constraints, we will see that at all these different pieces. At the fifth, the replenishment rounds that we will see, but also obviously with regards to the WHO. I would see three things that from my WHO perspective are key. And that is the financing of the Contingency Fund, which was created after the West Africa Ebola crisis, which practically ensures that WHO can send the fire brigade before it becomes a huge fire. And I think it's a complete disaster that this is chronically underfunded and only a number of member states currently contribute to it. And even among the G7, there's not much, at least from some, not much investments. The same is true for the one workforce in pandemic preparedness and response in an international organization that we have. The World Health Emergency Program is chronically underfunded and remains throughout this crisis chronically underfunded, funded only by 60%. This is completely unacceptable. The last point that I'd like to mention, because it's clearly linked to the IHR core capacities, is the polio assets. So practically the health workforce that was established through the polio eradication program, and that still exists in many of the developing countries. This is practically the surveillance structure that the world can offer if there's any outbreak. However, it's chronically underfunded. It's hard to raise the funding for it. It's reintegrated into WHO, but there's no funding for it at this moment of time. Yeah. So certainly I remain optimistic. We need to be fully enthusiastic, and I think there are lots of pushes forward. I think we can do it. I think that certainly civil society has a key role to play in all these discussions. And coming back to the financing of WHO, it is interesting to see that if we leave member states outside and ask anybody else, so practically all other non-state actors, they would say this is an easy target, this is low-hanging fruit, and huge investments into WHO are needed. There's a complete consensus from everybody outside the WHO. So there need to be further pushes from civil society, not only in WHO, but obviously also beyond. I think that certainly can be a game changer in all these different settings, especially with the governments that are not yet fully on the side of spending more on preparedness and response. And we can also see that in the debates that we are having in my working group, because it's the setting of a member state-driven working group. Civil society has not been included transparently, unfortunately, but in the open debates in the EB, where the civil society can watch and also has a voice, the tone is completely different from the same member states. So you make a difference, and you certainly need to push further. And with that, I remain optimistic that we can use this year to really implement the lessons that we learned from the current, but also from past crises. And with that, thank you very much.
Thank you very much, Björn. I'm sure this is not the last time we come together in this or in different rounds to talk about these very important topics. Thank you very much for all your recommendations and perspectives. Although we are coming to the end of the event, this is not, as I said, the end of the discussion of the whole topic. And I'm also very happy to announce that there will be one expert team in the Global Health Hub Germany that will be working on this topic in the next month on global health architecture and also financing. And today's webinar offers the starting point for this discussion that are there ongoing. For the end of the webinar today, the organizers have asked me to make sure I tell you that there will be an evaluation of this event, and I think the link will be now sent into the chat box. So maybe you have a couple of minutes to let us know and provide some feedback. I would also like you to inform that there will be another webinar hosted by the Germany's Global Health Hub in the near future on March the 9th, where the State Secretary of the Federal Ministry of Health and the Sherpa from the Federal Chancellery will present the G7 health priorities and discuss with G7 engagement groups. Yeah, we see the slide here. So I hope to see you all back then. There will be also, I think, the registration link for this event will be posted in the chat box. And if you want to stay informed, please check out the website of the Germany's Global Health Hub or become a member or maybe got onto the mailing list. And for now, I thank you very much to the speakers, Björn, Kate, and Amanda, and also for the organizers, especially Christina and Rositza, for all their preparation and amazing help. And I thank you very much for your for all the participation and the good questions in the chat box. And I wish you a good afternoon. Thank you.